symptoms of colon cancer, of course, there'll be the general symptoms. You'll have loss of appetite, loss of weight unexplained, a lot of fatigue. And then, of course, the symptoms specifically to colon cancer, you'll have a lot of loss of weight, and you'll have rectal bleeding. You find maybe you're passing stool and there's bleeding in your stool.
For this patient specifically, we are doing both upper, that is esophagogastroduodenoscopy, and we're also going to do a colonoscopy. So that helps us assess both parts, the upper and lower of the digestive system. There remains a very significant portion in the small intestine that we do not inspect using this.
In the quiet corridors of our hospitals, behind the closed doors of consultation rooms, a silent killer continues to rise, often undetected, often too late. Colon cancer, once considered rare in our region, is now becoming alarmingly common in Kenya. Yet, with early detection and timely intervention, it is one of the most preventable and treatable cancers. In this episode, we take you into the heart of Kenya's fight against colon cancer. We explore the crucial role of endoscopy and colonoscopy, not just as diagnostic tools, but as life-saving procedures. These are not just medical terms, they are windows into the body, allowing doctors to spot dangers before it becomes deadly. We meet Dr. Samir Pandya, a surgeon, who will take us through both procedures, demystifying the process and showing us just how critical yet accessible this technology can be. Dr. Anjuguna, a family physician, will take us through the ins and outs of colon cancer. This is a story of science, courage, and the power of prevention.
My name is Dr. Anjuguna. I work at Empisha Hospital. I run the family medicine and staff clinic. So colon cancer, it's the best way to explain it is to first explain the gastrointestinal tract. So you go from the mouth to the esophagus, which is where your food goes down. You have your stomach, then you have what's called the small intestine. It's divided into two parts. So you have the duodenum and the ileum. That's called the small intestine. Then you have the large intestine. So from small intestine, you have a large intestine, which ends with what we call the rectum, and then the anal opening. So colon cancer is essentially cancer of the large intestine.
Later on, we'll be observing two important procedures, an endoscopy and a colonoscopy. Both are crucial when a specialist needs to conduct a thorough examination of the gastrointestinal tract, helping to diagnose and understand conditions affecting the digestive system.
I'm Dr. Samir Pandya. I'm a surgeon, specialized in endoscopy, laparoscopy, and surgical oncology. I work in Empisha Hospital. I'm the head of surgery and anesthesiology. Today we are going to have a patient who has had common symptoms of bloating, acidity. Basically, we call them dyspepsia.
In Kenya, acidity and dyspepsia, often described simply as indigestion, are common digestive complaints that affect a wide range of people across various age groups. These conditions are frequently seen in both urban and rural settings, often driven by dietary habits, stress, and in some cases, underlying medical conditions. Now, what is endoscopy?
Endoscopy entails putting a camera through a device that has a camera through the mouth and inspecting the upper gastrointestinal tract. We call that esophagogastroduodenoscopy, and that assesses the food pipe, the stomach, and the duodenum, first part of the duodenum. It helps us pick most of the common diseases and pathologies in that place, especially things like gastritis, which is caused by H. pylori on many occasions, and it's also diagnostic for cancers, for other symptoms of heartburn and gastroesophageal reflux disease and peptic ulcer disease.
Colon cancer has a myriad of risk factors, but before we look at those, let us first consider its rising prevalence in our nation. Once considered a disease of the West, colon cancer is now making headway in our country and is appearing more frequently in local hospitals and clinics.
It's fairly common, it's underdiagnosed, and most of the time when found it is quite late. but it is quite common and growing in prevalence with time. So colon cancer, the first thing is age. Of course, it can happen in any age group. You can even have it in younger people. You may say more men, it's more prevalent with men, but we're also having women with colon cancer. It's a bit older. You probably would get it a little bit older, not too young, so maybe over 40. Also diet, smoking history. And of course, with colon cancer, we have a precancerous lesion called polyps. So if you have a colonoscopy, maybe a routine checkup, and you find you have polyps, there's a chance of those polyps becoming precancerous and cancerous. So that also is a risk factor if you're found to have polyps in your colon during a routine colonoscopy.
Today's patient has battled persistent stomach acidity with little success from previous treatments. Dr. Samir now plans to perform an endoscopy and colonoscopy to thoroughly examine her digestive tract and uncover any hidden issues.
For this patient specifically, we are doing both upper, that is esophagogastroduodenoscopy, and we're also going to do a colonoscopy. So that helps us assess both parts, the upper and lower of the digestive system. There remains a very significant portion in the small intestine that we do not inspect using this. But for that, now there are later technologies like capsule endoscopy and other studies that we can.
We spoke to Dr. Njuguna about colon cancer. So ideally, a colonoscopy would diagnose that, right?
Yes. So there are other modalities now in endoscopy like narrowband imaging and other modalities that we can use to also pick up less obvious lesions. But yes, for colonoscopy remains the main standard for diagnosing colon cancer. And most importantly, we can take a biopsy. And once we have the biopsy, we need histopathological diagnosis when you're diagnosing cancer.
And how soon will you have the results of this procedure, of this colonoscopy and endoscopy?
So I'm not anticipating finding any such lesion in the patient, but say we had a patient who had that, then once we take the biopsy, it takes about 1 to 2 weeks for us to get the pathology reports.
Before we observe the endoscopic procedure, let us take a moment to consider the symptoms of colon cancer.
So symptoms of colon cancer, of course, there'll be the general symptoms. You'll have loss of appetite, loss of weight unexplained, a lot of fatigue. And then, of course, the symptoms specifically to colon cancer, you'll have a lot of loss of weight, and you'll have rectal bleeding. You find maybe you're passing stool and there's bleeding in your stool. That would be something that is in fact, blood in the stool is a telltale, or we have a very high index of suspicion for colon cancer.
Many people with hemorrhoids do worry about the possibility of colon cancer, especially when they experience symptoms like rectal bleeding, changes in bowel habits, or abdominal discomfort. It is a natural concern, given how closely some of these signs can resemble those of colon cancer, but they are different. It is always important, however, to see your doctor in case of any rectal bleeding.
No, hemorrhoids, I would say, are not related to colon cancer. Hemorrhoids are enlargement of the vessels in the rectal area due to straining. People who lift a lot of weights, people who are constipated a lot and have to strain when passing stool, pregnancy, those are all risk factors for hemorrhoids.
Now, we observe Dr. Samir as he starts the endoscopy procedure. For same-day endoscopy and colonoscopy, as is the case with the patient, fasting is done for 8 hours and fluid stopped a few hours before. Laxatives are also administered the day before to clear the bowel. The patient is laid on their side. A local anesthetic may be sprayed at the back of the throat to reduce discomfort, and a mild sedative given through an IV to help the patient sleep through the process. The endoscope is a thin, flexible tube with a camera and a light that sends real-time images to a monitor, helping the doctor examine the upper digestive tract. Next, he inserts the endoscope into the patient's mouth and starts the examination procedure. The patient's vitals are closely monitored, including heart rate, blood pressure, and oxygen levels. This is to ensure safety throughout the procedure.
So, for you guys, see that?
Yeah.
This is the stomach. Now, when you see this, This is called hemorrhagic gastritis. It's not an obvious ulcer. So this is a patient who has symptoms of gastritis. There are different types of gastritis that we can diagnose with this, which is most accurate with this modality and not the others.
The camera at the tip of the endoscope sends real-time images to a monitor, which gives a clear view of the inner linings of the digestive tract. Dr. Samir carefully inspects for any sign of disease or damage, such as ulcers, bleeding, inflammation, which may point to conditions like gastritis. He also looks out for any abnormal growths, such as polyps.
We can also take biopsies for all the other lesions and also check for H. pylori and confirm the gastritis. The roof of the stomach.
A biopsy is a small tissue sample taken from the areas that look abnormal. This is done using tiny forceps passed through the endoscope, and the procedure is quick and painless as the digestive tract lining doesn't have pain sensors.
With the narrowband imaging, we can actually pick up small nodules that you might not see obviously. So this case not very significant, so we can leave, and it helps us assess what type of lesion it might be.
Once the procedure is finished, the endoscope is gently withdrawn.
Yep, we're done with the upper.
Coming up after the break.
Is there any connection between H. pylori and colon cancer?
H. pylori is more related to gastric cancer, cancer of the stomach.
That's right, the colon is not straightforward, so you might be wondering what's happening.
Yeah.
Yeah, but yes, we are trying to maneuver through it.
So far, we have followed the endoscope as it explored the upper digestive tract, helping doctors uncover hidden causes of discomfort. After the break, we take you inside the colonoscopy procedure, where the search continues, this time deeper into the gut. We shall also speak to Dr. Anne one-on-one as we continue to explore colon cancer. Don't go away. And now for a short healthcare tip. Digestive health often goes unnoticed until symptoms become severe. Procedures like endoscopy and colonoscopy are powerful tools that help doctors detect early signs of conditions such as ulcers, inflammation, polyps, and even cancer, often before symptoms appear. It is especially important for people over 50, those with a family history, or anyone experiencing persistent digestive symptoms, to talk to their healthcare provider about screening. Early detection through these procedures can significantly improve treatment outcomes and save lives. Remember, don't ignore persistent symptoms. Timely medical evaluation is crucial.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. So far, we've seen how an endoscopy offers doctors a clear look into the upper digestive tract, helping to uncover possible causes of long-standing symptoms. We've also explored key facts and concerns surrounding colon cancer. Now, we move to the next vital step, the colonoscopy, which allows doctors to examine the lower digestive system for any hidden signs of disease. But first, let us hear from Dr. Anne one-on-one.
So in our country, we seem to have health-seeking behaviors that are not very good because people with especially cancer or any major illness tend to always come late. Why do you think that is the reason?
I think the main reason probably would be financial. We're in a country where, most of us are living paycheck to paycheck or, below the poverty line, if we have a poverty line. So a diagnosis or, everybody would think there's something, I'm going to have to spend a lot of money. So that, I would say it's financial. Secondly would be also African culture. We tend to only go to hospital when things are really bad. You may have a bit of an ache here, pain here, a weird symptom, but you dismiss it and believe you will get better. So we do have that generally a cultural issue with seeking medical care.
You earlier alluded to the importance of getting colonoscopies or something, or even endoscopies. When should somebody start getting them?
I would say 40 years, either male or female. That's when generally you should start doing your cancer screening. A little bit more for colon cancer, a little bit more for males to do your routine colonoscopy. But yeah, around 40. And if at all it is earlier than 40, if you have some symptoms.
And what if somebody cannot afford colonoscopy? Is there anything else that can be done?
Unfortunately, to really be able to identify or to rule out or screen for colon cancer, the best and most efficient use of your money would be to schedule a colonoscopy. We do have tumor markers, which are not cheap also, and will not really give you the diagnosis. They may be high due to even different reasons and such. So your mainstay real way of checking, guaranteed way of getting your results is doing a colonoscopy.
Is there any connection between H. pylori and colon cancer?
H. pylori is more related to gastric cancer, cancer of the stomach. Prolonged treatment or management of H. pylori can be associated with gastric cancer. But colon cancer specifically, there is no direct correlation between colon cancer and H. pylori.
Next, the patient will undergo a colonoscopy to examine the inner lining of the large intestine and the lower end of the digestive tract. During an endoscopy, polyps can often be removed using special tools that are passed through the endoscope.
Mostly, if you can get the polyp out, then the pathologist can tell you what kind of pathology it is. Then if it is precancerous, you've already sorted out. If it is something that you couldn't get out, then you can go back in and get it.
And if it's precancerous, what then is the treatment?
So for precancerous polyps, it depends on the degree of dysplasia on the pathologist's side. They will tell you if it is moderate and low, it takes quite some time before they become precancerous and cancerous. When it is high-grade dysplasia, which is precancerous, it can take 5 to 10 years before it becomes. So once you get the polyp out, you at least sorted that out. Then you can do surveillance every 5 or 10 years.
Then the patient can take preventative measures.
We don't treat based on that. Then the patient will just undergo surveillance 5 to 10 years later.
Okay.
Yeah.
So now you're going to do the colonoscopy?
Yep. Because she had constipation, but to just check. For in her case, it's more of screening.
So have you seen anything unusual inside?
She has gastritis, which is a common finding in most patients. So while we are there, we take the labs to check if it's gastritis, and we check for H. pylori. H. pylori is there's a very high prevalence in our setting, and over time it exaggerates the symptoms, and over time it can predispose you to stomach cancer.
The surgical team begins to prepare the patient for the colonoscopy procedure. The patient is positioned comfortably on their side, and vital signs are monitored closely. The doctor gently inserts a flexible tube called a colonoscope into the lower part of the digestive tract. it has a tiny camera and light that sends live images to a monitor, allowing careful inspection of the colon. To ensure a clear view, the colon must be empty, so patients take laxatives beforehand and fast for several hours. Colonoscopy plays a crucial role in diagnosing various digestive conditions. The doctor continues to carefully navigate through the colon, closely examining the lining for any abnormalities such as inflammation, growths, bleeding, or unusual tissue that might require further investigation.
Actually, the colon is not straightforward, so you might be wondering what's happening.
Yeah.
Yeah, but yes, we are trying to maneuver through it, huh?
Is it very long?
Yeah, colon is usually long and tortuous. So the upper one is more straightforward. This one depends on the patient's anatomy, but usually we get to the end of the colon and we try to enter the area called the terminal ileum. Huh?
Oh, so you have to get to the end of it.
Yeah. That's when you have fully assessed it. So rarely we are not able to get there, sometimes because of some technical issue, but otherwise we...
If any abnormal small growths, like polyps, are found, they can be removed immediately using a small tool passed through the colonoscope. If necessary, the doctor may also take biopsies for further analysis. The intestines and rectum are lined with mucus. This mucus helps lubricate the passage of waste, protects the lining from irritation and bacteria, and plays a role in immune defense. The surgeon finally reaches the end of the colon.
So we've reached the end of the colon. Eh? We just now trying to see if we can get into the...
The yellow substance seen in the upper end of the colon is usually bile-stained digestive residue. The surgeon now wishes to examine the small intestine before concluding the procedure to ensure a thorough evaluation of the digestive tract and check for any abnormalities that may have been missed.
We're at the end. I'm just trying... I'm just trying to get into the small intestine to complete the examination. I was already in, but I came out. There it is. She has no diarrhea, right? Only, yeah. So let me see if I can just... So this is a small intestine now from the colon, huh?
Right.
It's called the terminal ileum.
So he has like a yellow something.
That's part of the digestive juices, the water that she used for preparing her colon.
All right.
So it's everything a mix, huh? So we give them something to clear the colon.
Okay.
See, that's the small intestine, okay?
Yeah.
Now when you come out, you're in the large intestine. Good. So basically just go through the whole colon now, systematically, and check. So this is normal. See this?
Yes.
That's pink and it's got blood vessels in a normal pattern. You have to know what's normal for that. So if we find anything suspicious, we can then take biopsies.
Once the examination is complete, the scope is slowly withdrawn while the doctor continues to inspect the colon lining. The procedure usually takes 20 to 45 minutes. Most patients recover quickly with only mild bloating or cramping due to the air introduced during the process.
So now you're going backwards?
Yeah. So we basically go in, unless there's something obvious. Then when you're coming out, we do a good assessment, a thorough assessment. So we also take the pictures and everything of each segment,
Okay.
so that we have evidence,
Right.
especially with something abnormal. Huh?
Okay. So what happens after this?
So she'll be in recovery since we have sedated her. She'll be in recovery, take 15-20 minutes to wake up. Then we'll allow her to fully wake up, and then she will go home, preferably escorted by someone. Then she'll come back in a week or two's time and have a report from what we had done, and we will now advise her further.
So you were saying this is now quite a common procedure?
Yes, it's a very common procedure.
How many people do you tend to see?
Sorry?
How many people do you tend to see daily or weekly?
So on a daily basis, of course, my colleague is in charge of the department. The nurse would be better placed to give you all the numbers because I don't do all of them.
Okay.
But yeah, on a daily basis, we are doing at least about 10 procedures from Monday to Friday and even on Saturdays. And then the emergency procedures, especially when people vomit blood and they have some blood in the stool, then again, that becomes an emergency and we check.
So have you seen anything unusual in her colon?
For her, nothing, very grievous, but yes, she has some gastritis and possibly some gastroesophageal reflux disease.
Or GERD?
Yeah.
You saw that in the upper
Yes. The end of the esophagus looks like it's been injured by continuous reflux of acid.
So for somebody who has had, say, heartburn for very many years and has been managing it over the counter, how important is an endoscopy?
Very important because they have to understand, one, we need to know why they have those symptoms. Two, if the over-the-counter drugs are not working, it means there's something more to it, and it is better to identify the cause. Is it because of mechanical issues like the hypothermia? Is it because of gastritis that can be exacerbated by H. pylori infection? Is it because of other issues that we can pick up once we do the endoscopy?
Now, the mainstay of colon cancer treatment is early detection through screening, especially via colonoscopy, which can also remove precancerous polyps. There are also key preventative measures.
So colon cancer, the mainstay of treatment would be, there's a surgical option, then there's chemotherapy and radiotherapy, depending on the severity of it. So if it is quite localized, you could consider resection of that part, and then followed up with some chemo and radiotherapy. Depends on the severity. If it's very advanced, very spread out, then chemo and radio, sometimes resection is not really relevant. Maybe it's already gone to the liver and other organs. Chemotherapy and radiotherapy would be the best option. The major issues with cancer and colon cancer is basically the processed foods, what we would consider junk food, anything that is unhealthy. So, more fruits, more vegetables, having healthy bowel movements. And of course, as you get older, maybe over 40, regular colonoscopy would not hurt.
As we wrap up today's episode, we've taken a closer look, quite literally, at the powerful role of endoscopy and colonoscopy in diagnosing digestive conditions and detecting colon cancer early. Colon cancer remains one of the most common and preventable cancers, and as we've seen, these procedures are not just diagnostic, they can be life-saving. From persistent symptoms to silent threats, getting answers starts with taking the first step towards screening and awareness. Thank you for joining us. And until next time, stay informed, get screened, and take charge of your health.